This is Breakthroughs, a podcast from Northwestern University Feinberg School of Medicine. I'm Erin Spain, Communications Director at Feinberg. Most people with peripheral artery disease, known as PAD, have great difficulty walking and few treatments to help. Preliminary results of a new Northwestern medicine study suggest that cocoa may have a therapeutic effect on walking performance in people with PAD. Dr. Mary McDermott led this study and has dedicated her career to lower extremity PAD research. She's conducting a variety of clinical trials to test new interventions to improve walking in people with PAD. She's also the Jeremiah Stamler Professor of Medicine and Preventive Medicine here at Feinberg. Thank you so much for joining me today.
It's a pleasure to be here. Thank you for having me.
Well, before we get into this finding about cocoa and chocolate, tell me a little bit about PAD and why you were drawn to studying this disease.
So peripheral artery disease is a very important condition because it actually affects 10 to 15% of people age 65 and older. So peripheral artery disease consists of atherosclerotic blockages of the arteries supplying the legs. The blockages in leg arteries prevent oxygen delivery to the leg muscles when people try to walk.
Just walking across the street, that type of thing can be difficult?
Yes, typically walking 1 or 2 blocks is difficult and people will have to stop because of debilitating pain or weakness or tightness in the legs after just 1 or 2 blocks.
So what therapies right now are there for these folks? What exists?
Unfortunately, there are not many medical therapies. There are only 2 FDA-approved medications, of which one is considered no better than a placebo pill. And exercise works. However, most people with PAD have great difficulty walking for exercise because when they walk, it hurts their legs.
How did you get started studying this disease?
I've been studying this condition for about 25 years, and I got into it because it's such a common and important problem, and there were not enough investigators studying it.
So you've been leading some clinical trials. You've led clinical trials funded by the National Institutes of Health, Patient-Centered Outcome Research Institute, testing novel interventions, drugs, supplements, exercise interventions, even a device. But this one we're talking about today is one of the first to study PAD and cocoa. Why did you decide to investigate chocolate, cocoa?
Well, there's growing evidence that chocolate, dark chocolate in particular, has a number of health benefits. And some of the benefits that have been observed in animals include things like improving blood flow or perfusion of tissues and also improving skeletal muscle function. And patients with PAD have problems with blood flow and they have problems with their leg skeletal muscle. So this seemed like it might be a good therapy.
And there were some previous studies done that looked at this a little bit?
Yes, there are animal studies, but also there's one in particular prior study done in patients with peripheral artery disease, published almost 5 years ago, showing that dark chocolate had an acute benefit on treadmill walking ability. But this is the first trial to study it on a daily basis. The patients in this trial took the dark chocolate every day.
Yeah, tell me a little bit more about dark chocolate specifically. What is it inside of dark chocolate that makes it such an interesting food to study?
Dark chocolate or cocoa comes from the cocoa plant. And that plant contains something called flavonols, which is a nutrient that is in dark chocolate. And it has these beneficial properties that I mentioned of improving blood flow and helping skeletal muscle.
So you hypothesized that cocoa could improve a 6-minute walk distance. Now, how did you choose 6 minutes when you're setting this up?
Sure. So the 6-minute walk test is a well-accepted, well-validated measure of walking endurance. And we studied it because patients with PAD in particular have difficulty walking, and it's a measure of walking endurance. So it measures exactly the problem that they have walking long distances.
Okay, so again, this is a clinical trial, but it's a pilot and further research is going to be needed. But let's talk about these preliminary results because they're pretty exciting. They're published in Circulation Research. Tell me about the trial and what did you find?
So we randomized 44 people with peripheral artery disease to either the cocoa beverage. We asked them to drink 3 cups of hot chocolate a day. It was a dark chocolate. or a placebo, which had an identical appearing beverage that was also drank 3 times a day. And the only difference between the two drinks was that one contained the dark chocolate with the flavanols that I mentioned, and the other did not. So the participants did this for 6 months, and we measured 6-minute walk at baseline and follow-up. We did muscle biopsies to look at their muscle. We measured blood flow as well.
And what did you find?
So at 6-month follow-up, we found that the participants who had been drinking the dark chocolate for 6 months had significantly greater improvement in their 6-minute walk distance compared to the group that was taking the placebo. Also interesting is that this calf skeletal muscle biopsy showed greater improvement in those who took the dark chocolate versus the placebo. Specifically, we saw an improvement in overall muscle health. We saw an improvement in capillary density. Those are tiny blood vessels that grew in the muscle. And third, we found improved mitochondrial activity and improved ability to generate energy to the muscle. And finally, we also saw improved perfusion measured by MRI.
What does the biopsy, the calf muscle biopsy, what's that process like?
What we do is we numb the leg area with some lidocaine, and then a small incision is made and about 200 milligrams of the calf skeletal muscle is removed. Absorbable sutures are placed, and the patient usually has difficulty and pain walking for the next 24 hours, but we see them back a week later and the scar heals nicely and they're feeling back to normal. And it's just such a valuable resource. We've done more than 600 of these muscle biopsies, and we've been able to learn a lot about the effects of peripheral artery disease on calf skeletal muscle.
So tell me the visualization that you see then when you're looking at the mitochondrial activity in this muscle, or you're looking at this under a microscope. What does this look like?
Well, some of my collaborators are able to make beautiful images of the muscle, and you see these elongated muscle fibers with peripheral nuclei, which would be characteristic of a healthy muscle. But in patients with PAD, you tend to see more fibrosis, which is scar tissue. And interestingly, you can see an attempt to compensate for the lack of blood flow with some additional blood vessels, kind of like collateral blood vessel growth.
So it's pretty easy to detect which are the PAD people when you're looking at these biopsies.
Their muscle is definitely damaged, but what's been surprising to us is it's very heterogeneous, so that there's not been one prototype that you always see in patients with PAD, but their muscle is generally not healthy.
You mentioned you used a cocoa beverage. What did this taste like? Is it something that you can go buy at the store?
Well, I just tried it today for the first time in preparation for our interview. But the active beverage does taste like a dark chocolate. So it's not perhaps as sweet as what you might typically think of as a hot cocoa, but it tastes like chocolate, and it tasted pretty good. And the placebo was a little bit different. It didn't have that dark chocolate taste.
I would also imagine there's fewer side effects from cocoa or chocolate. It's less expensive possibly compared to other therapies as well.
Yes, that's one of the wonderful things about it. If our preliminary findings are confirmed, it's widely available, it's widely accessible, it's inexpensive, and it's not difficult to take. And there are no side effects, essentially no side effects.
Let's talk more about that active ingredient that really makes a difference in dark chocolate versus milk chocolate.
Yes, that's a great point. So if you just eat milk chocolate, you won't get the types of benefits from the therapy that we were giving the patients. The plant the cocoa is normally alkalized. So when we eat a milk chocolate bar, the chocolate in it has been alkalized, which makes it taste better, but it also removes some of these nutrients, the flavonols in particular, that tend to bring the health benefits. So the result of this study should not make people just go out and eat more milk chocolate.
Were most of these folks in Chicago, most of the folks involved in the study?
Yes. So we recruited from the Chicago area, but we cast a wide net. And so we advertised with things like CTA bus and train ads, and we mailed postcards to people living in the Chicago area, and we recruited people from Northwestern Medicine. So we cast a wide net.
And did you use chocolate bars and pieces of chocolate in your advertising?
Well, it's interesting. Our advertising did have a picture of hot cocoa in a nice mug. So perhaps that was appealing to people.
I mean, this is what you study. You've tried a lot of interventions, and you said before exercise works. But to find something like this that even preliminarily seems to have this type of effect, that's pretty exciting.
Oh, I think it's incredibly exciting. And again, these patients are really limited in their mobility. They have such difficulty moving around, walking even a couple of blocks. So to find something that's so safe and accessible and inexpensive is really exciting. So we hope that this will be confirmed in future studies.
So this is around Valentine's Day. A lot of people might be eating chocolate at home. But as you mentioned, this study, I mean, there's still work to do. So what are the next steps? What comes now before people go out and start trying to eat a lot of dark chocolate if they do have PAD?
So we are hoping to be able to do a large phase 3 clinical trial, which would be a definitive study. And we've submitted a grant application for that purpose, but it hasn't been reviewed yet, and we don't know yet if we'll be able to do the study. We hope we will.
Talked about the health benefits of chocolate and heart health and different areas. Did you do a little background on cocoa and other ways that it's being used, or the other studies that have found benefits when you were setting up this study?
Well, there's another large study ongoing to see whether cocoa flavonols can prevent cardiovascular events. We won't have the results of that for another couple of years. But there was another study published just in the last year of older people without peripheral artery disease that also showed the 6-minute walk significantly improved in the older people who took the dark chocolate versus placebo. And what's really interesting about that is patients with peripheral artery disease have extreme problems with blood flow to the legs. But as we age, our blood flow gets a little bit worse too. So it was extremely interesting to find that even in relatively healthy older people, dark chocolate might have a benefit.
Thank you so much for being here today, sharing a little bit about this study. I think that all of us eating dark chocolate for Valentine's Day are going to feel a little bit better about the health benefits.
Thank you. Thank you so much for having me. It was really a pleasure.
Did you know episodes of Breakthroughs are accredited for CME, Continuing Medical Education for Medical Professionals? Go to our website, feinberg.northwestern.edu, and search CME to claim your credit.